Welcome to a deep dive designed just for you nursing students. As you're learning the fundamentals,
Yeah.
we're tackling patient interviews.
One of the most important.
Absolutely.
Yeah.
And you'll use this skill
All the time.
throughout your whole career.
It's interesting because it's not just asking questions.
Right.
It's about that rapport, building trust.
Making that connection.
So patients feel heard.
Yeah. So they really feel like we're listening to them, and we'll be exploring.
Really practical ways to do that.
Awesome. And drawing on a ton of research and best practices.
Compiled just for you.
Love that. And it's so true. It's not like we're just like robots collecting data.
Right.
This is about really connecting
You're a human.
with another person
Yeah.
who's entrusting us with their care.
Exactly.
Where do we even begin
Yeah.
with patient interviews?
The sources really highlight active listening as a core foundation.
Active listening.
Yeah.
It sounds
It sounds obvious.
kind of obvious, but
But what does that actually look like?
what does that actually look like in practice?
You know, it's funny because you can think about those times when you're talking to somebody and you
Yeah.
just know they're not really listening to you.
Right.
Even if they're like nodding their head.
Exactly.
And it's about truly tuning in to all those cues.
Okay.
Not just the words, but the tone of voice, their body language,
Right.
all those subtle things that can really tell us how they're feeling.
So we're like detectives gathering clues,
Yes.
trying to piece together
Exactly.
the whole story,
The whole picture.
not just the surface.
Exactly.
And I imagine that deeper understanding
Yes.
leads to better care.
Oh, absolutely. And more compassionate care.
Okay.
In fact, one of the studies that we have here showed that when nurses practice active listening, patients report feeling so much more satisfied with their care.
That's huge.
And they were more likely to follow through with their treatment plan.
That's a powerful impact. So, active listening. How do we actually do it?
Well,
Because it feels kind of...
abstract. Yeah.
Yeah, there are some really concrete techniques that you can use.
Abby.
One simple but effective one
Yeah.
is called reflection.
Reflection.
Yeah. And basically what you're doing is you're mirroring back what the patient has said
Okay.
to confirm you've understood them correctly, but also to encourage them to elaborate further.
Okay. So like for an example.
Like if a patient said to you, I'm feeling really overwhelmed,
Okay.
you might reflect back. You're feeling overwhelmed.
Got it.
And that can prompt them to tell you more.
So it shows that you're engaged, that
Yeah.
you're listening, and it gives them that space to
Like
kind of share more.
At their own pace.
At their own pace. Okay, but
Yeah.
active listening is just one piece of the puzzle, right?
Right.
What about asking the right questions?
Yes, questioning is another crucial skill.
Yeah.
And actually one of the sources has this really cool analogy
Okay.
of a cone.
A cone?
Yeah.
Why?
I'm intrigued.
To illustrate how to guide the conversation effectively.
Okay, tell me more.
So picture a cone.
Okay, got it.
You know, the ice cream cones.
Mm-hmm.
And so you start at the top of the cone with these broad, open-ended questions.
Right.
Things like, what brings you in today?
Yeah.
Or how can I help you?
Mm-hmm.
And these types of questions give the patient the freedom to just share
Yeah.
their concerns in their own words.
So it gets the conversation flowing.
Exactly.
It builds rapport.
Yes.
Okay, so we start broad from.
Yes.
How do we narrow down?
So as you move down the cone,
Okay.
your questions become more focused,
Okay.
more specific.
Got it.
You're essentially guiding the patient towards giving you the information that you need to make that accurate assessment.
I see.
And here's where it gets really important.
Okay.
We want to avoid leading questions.
Leading questions. Those are the ones that
Yes.
they kind of suggest
Suggest the answer.
the answer you're looking for.
So instead of saying, do you have any pain in your chest?
Right.
You might say, you're having some chest pain, aren't you?
Exactly. Yeah, which is leading them.
You're leading them to the answer.
And you're not going to get accurate information.
Exactly.
Okay.
Leading questions can really bias the patient's response,
Okay.
and it makes it hard to get to the truth.
Right.
A great example from the material is asking about shortness of breath.
Okay.
So instead of saying, do you get short of breath climbing stairs?
Right.
Which is a yes or no question.
Yes or no?
You could say, how many steps can you climb before you get short of breath?
Oh, that's good.
Which encourages a much more detailed and accurate response.
So they can paint a clearer picture of what they're experiencing.
Exactly.
Okay, so we've got active listening.
Yes.
We've got guided questioning down. What other essential ingredients go into a really effective patient interview? Besides those two?
Well, those are two major building blocks.
Wow.
But there's another element that's absolutely crucial.
Okay.
And this is especially for new nurses,
Right.
and that's empathy.
Empathy.
Yes.
You
hear that word a lot,
I feel like we hear it
especially in nursing.
all the time, especially in nursing. What does it actually mean, though?
Yeah. What does that really mean in the context of these patient
In
interactions?
practice, yeah.
It's more than sympathy,
Okay.
which is just feeling sorry for somebody.
Okay.
Empathy is about trying to step into the patient's shoes and see the world from their perspective.
Okay.
Really try to understand how they're feeling, even if you haven't personally experienced the same thing.
That sounds like a challenge.
It is challenging,
Especially as a new nurse.
especially as a new nurse.
So you haven't seen
Right, you haven't encountered
all the things.
all the things.
Yeah.
But it's a skill that can be developed with practice.
Okay.
One really helpful tip from the material
Okay.
is to simply acknowledge the patient's feelings. You don't have to agree with them or try to fix anything. Just validate what they're experiencing.
So instead of like brushing it off and being like, oh, don't worry, it'll be okay,
Right.
you might say, it sounds like you're really anxious about this procedure.
Exactly.
Is that right?
Yes.
Okay.
That simple acknowledgement can make a world of difference.
Because it shows that you're present.
Yes, you're listening.
That you care.
You're there for them.
And that ties back to what we were talking about with
Right.
active listening
Exactly.
and building trust.
Yes, because when patients feel understood, they're much more likely to open up and share important information with you.
Yeah, that makes sense. They feel safe
Right.
to be vulnerable.
It creates that safe space for them to share.
Yeah, to share. Okay.
Yeah.
So,
Yeah.
but what about those situations where patients maybe are like less than forthcoming
Mhm.
or they're presenting with some challenging behaviors?
Yes.
The sources dive into a whole array of these scenarios
Yeah.
that every nurse is bound to face.
You're right. And being prepared to navigate these situations can really help boost your confidence.
Yeah,
And
absolutely.
you'll be able to provide more effective care.
Okay.
Take the silent patient, for example.
Okay.
It can be tempting to rush in and just fill the silence.
All right.
But sometimes silence is exactly what the patient needs to
It
gather
can.
their thoughts or maybe process their emotions.
So how do we approach that then?
Instead of forcing the conversation, try offering some gentle prompts
Okay.
or reflections.
Like what?
You could say something like, "You seem quiet.
Okay.
What's on your mind?
Hmm.
I'm noticing you look worried.
Right.
Is there anything you'd like to talk about?"
So giving them that space
Exactly.
to lead.
Yes.
But what about on the flip side?
Uh-huh.
The talkative patient
Oh, yes.
who's sharing maybe more than we need.
Yes, that's another common one.
The clinical situation.
Yes, and it's all about trying to find that balance between allowing the patient to express themselves, but also keeping the conversation focused.
Okay.
One technique that I find really helpful, and it's highlighted in the material, is summarization.
Summarization. So like recapping what they've said.
Exactly. So after the patient has shared their thoughts, you can say, "So to summarize, you're concerned about X, Y, and Z.
Right.
Is that correct?"
Right.
And that shows that you've been actively listening. It helps to kind of organize all the information.
Right.
And then it allows you to gently redirect if needed.
That's so helpful.
It is.
Especially when you're feeling overwhelmed.
Right. You've got all this information.
Yeah, you're like, oh my gosh, there's so much.
Right. And it helps bring some structure to the conversation.
But without shutting the patient down.
Exactly.
Okay. So
Yeah.
now let's switch gears a little bit
Okay.
to another crucial part of patient interviewing.
Okay.
And that's bringing up those sensitive topics
Yes.
that can sometimes be awkward or
Yeah.
uncomfortable to discuss.
Absolutely.
So we're talking about like sexual history,
Yes.
substance use, end-of-life care.
Exactly.
Right, babe.
Those are all important conversations that we can't shy away from.
Right, because that information is so vital.
Yes. To providing really holistic and appropriate care.
So how do we approach these conversations
Yeah.
in a way that's going to respect the patient's dignity
Right.
and build trust?
The sources really emphasize the importance of non-judgmental communication.
Okay.
Remember, our role as nurses is to gather the information,
Okay.
not to judge
Right.
or to shame the patient.
Not there to judge.
Right.
Okay.
And it's so important to be upfront about why you're asking these questions.
So instead of just jumping into these sensitive questions,
Right.
you might say something like,
Yeah.
to get a complete picture of your health history, I need to ask you some personal questions about your sexual health.
Exactly.
Is that okay with you?
Yes, that acknowledges the sensitive nature of what you're about to ask,
Right.
but it also gives the patient a sense of control. You're not springing anything on them,
Right.
and you're giving them an opportunity to decline or ask clarifying questions.
Okay. So creating that partnership,
That partnership.
that mutual respect,
Exactly.
which is so important in all patient interactions.
Yes.
Now, this brings up another sensitive topic.
Okay.
Informed consent.
Yes, informed consent is so crucial.
Mm-hmm.
And the sources emphasize that it's an ongoing process.
Right. It's not just a signature.
It's not just a signature on a form.
Exactly.
Yeah.
And it's about making sure that the patient really understands
Yes.
the risks, the benefit,
The alternatives.
of a procedure or treatment
Mm-hmm.
before making that decision.
Absolutely.
But sometimes it feels like just another task on the to-do list. How can
Yeah.
we make it really patient-centered?
One of the keys is to use clear, easy to understand language,
Okay.
avoid medical jargon,
Right.
and break down complex information into digestible chunks.
So it's not just reading off a script
Right.
or handing them a pamphlet.
It's having a conversation
It's a conversation.
and making sure that they understand.
Yes, making sure that they're following along
Yeah.
and encouraging them to ask questions.
Encouraging them to ask questions. Okay,
Shit.
so it's a two-way street.
It is.
Okay, so
Absolutely.
we're not just delivering information.
Right.
We're making sure it's received.
Yes, making sure they understand it.
That makes sense.
Mm-hmm.
Now, speaking of empowerment,
Yes.
let's talk about those situations where patients need additional support
Okay.
to communicate effectively.
So we're talking about working with interpreters,
Right.
understanding advanced directives, disclosing serious news.
Yeah, all those things.
These are all situations that can feel daunting,
Yeah, especially for a new nurse.
especially as a new nurse.
Yeah.
But the good news is there are specific strategies that we can learn
Okay.
to help us navigate these situations.
Okay, good.
For example, when working with an interpreter,
It's so important to remember that you're still communicating directly with the patient, not the interpreter.
So instead of saying to the interpreter, ask her if she has any pain,
Right.
you would say to the patient, are you experiencing any pain?
Exactly.
Okay.
And then allow the interpreter to facilitate.
To bridge that gap.
Exactly.
And it's also important to speak clearly.
Yes.
Use simple language.
Uh-huh.
Avoid medical jargon.
Right, because
Okay.
the interpreter is there to bridge the communication gap,
Right.
not to make medical decisions or
Right.
give medical advice.
Okay, so it's about respecting that patient autonomy.
Absolutely.
Making sure they're the center,
Yes.
even with that extra layer
Sure,
of
it's-
complexity.
Yeah.
And that same principle applies
Yes.
to advanced directives.
Yes, absolutely. Advanced directives are those legal documents that outline the patient's wishes
Right.
regarding their medical treatment if they're unable to make decisions for themselves.
And as nurses, we play a really big role in educating patients
Yes,
about these documents,
absolutely.
encouraging them to have those
With
conversations
their loved ones.
with their loved ones. Yeah.
It's about empowering them to make those choices
Right.
and ensuring that their wishes are honored even when they can't advocate for themselves.
And that brings us to another
Yes.
challenging but
Yeah.
incredibly important
Yes.
topic. Disclosing serious news.
Yes, those are conversations that nobody wants to have,
Right.
but they are an inevitable part of healthcare.
Yeah, absolutely.
And the source material actually highlights a really helpful framework
Okay.
called the SPIKES protocol
Okay.
for having these difficult discussions.
What's that about?
SPIKES is an acronym
Okay.
that stands for Setting Perception, Invitation, Knowledge, Emotions, and Strategy and Summary.
Okay. Wow.
It's a mouthful,
It is a mouthful.
but it's a structured approach
Okay.
that guides you through the process of delivering that bad news in a compassionate and supportive way.
So it's not just blurting out the news.
Exactly.
Start moving on.
You're creating a safe space for that patient to process the information, express their emotions,
Ask questions.
ask questions.
And one thing I found really interesting about spikes
Yes.
is that emphasis on pausing
Yes.
after delivering that initial news.
Yes. Allow the patient time to absorb
Yeah.
what they've heard before you jump in and
Right.
start explaining things.
It's like pressing pause on a movie.
at a really climactic moment.
It's the immerse part.
Yes. And you need that time
You need to process it.
to absorb what you just saw.
Absolutely.
You need that time to process before you can continue watching.
Exactly. And I think it can be so easy to get caught up
Yes.
in all the medical details
Right.
that we forget to just be present with them.
Yes, in that moment, in
Yeah.
their experience.
And that makes me think about another situation that can be really emotionally charged, dealing with those patients that are angry or aggressive.
Uh-huh.
How do we maintain our composure
Yeah, that's a great question.
and provide compassionate care even when we're faced with those behaviors?
You know, that's something that every nurse is going to encounter at some point.
Oh, yeah.
The sources really emphasize those de-escalation techniques.
Okay.
And remember, the patient's anger is often a symptom of something else.
Right.
Pain, fear, frustration.
Okay.
So try to understand what's driving that behavior
Right.
rather than taking it personally.
It's like that saying,
Yes.
hurt people hurt people.
Exactly.
So their anger might not even be at you.
Right. It might be at the situation or the system.
Yeah. Okay. So once you've taken a moment to assess the situation,
Yes.
make sure you're safe.
Safety first.
Yes. How do we de-escalate?
You can start by validating the patient's feelings.
Okay.
You might say something like, I can see that you're upset. Can you tell me what's going on?
Okay. So just acknowledging
Acknowledging.
that you see them, that you hear them.
Yeah, being willing to listen can sometimes be enough to kind of diffuse the tension.
But what if the situation escalates
Yeah.
and we don't feel safe?
If you feel threatened, or if the patient's behavior is becoming dangerous, it's essential to remove yourself from the situation
Right.
and call for help.
Get out of there.
Your safety is paramount.
Safety first.
You can't provide effective care if you don't feel safe.
Absolutely. Okay. So now switching gears a little bit.
Okay.
The sources also touch on the importance of recognizing and addressing health literacy challenges.
Yes.
What does that mean?
So health literacy refers to a person's ability to understand and use health information
Okay.
to make informed decisions.
Okay.
And unfortunately, a lot of people struggle with low health literacy.
Right.
And that can really impact their ability to manage their health.
So it's not just about, like, can they read?
Right. It's not just about basic literacy.
Right.
It's about, can they understand medical jargon?
Okay.
Can they navigate the healthcare system? Can they follow their treatment plan?
Okay. So as nurses, we need to be aware of that.
Yes, be aware of those challenges.
Yeah.
And really adapt our communication.
Okay. How do we do that?
One helpful technique is the teach-back method.
Teach back. So we're teaching it back to them.
You're basically asking the patient to explain back to you what you've just told them,
Oh, okay.
not to test them
Right.
or make them feel inadequate.
Not a quiz.
Not a quiz.
Okay.
It's really to ensure that they understand
Got it.
and identify any areas where you need to clarify or simplify.
So we're not just giving them the information.
Yeah.
We're making sure they've got it.
Making sure they've received it and understand it.
It's a two-way street.
It is.
Okay. So much covered in this deep dive.
Ah,
Active listening,
yes.
guided questioning, empathy,
Challenging situations.
sensitive topics. But it all comes back to that core idea.
Exactly.
Patient-centered care.
Patient-centered communication.
Communication, yes.
Every interaction we have with the patient is an opportunity to build trust,
Right.
to gather information,
And empower them.
empower them to take an active role in their own care.
And all of these skills that you're learning now as nursing students will be so valuable
Absolutely.
as you move forward.
Throughout your entire career.
It's like learning a new language.
It is.
A language of compassion and understanding and respect.
And like any language, it takes practice.
It does.
So don't get discouraged if you don't feel like an expert communicator right away.
Right.
Seek feedback from your instructors, observe experienced nurses,
Right.
and reflect on your interactions.
What can we do better next time?
Exactly what went well. What could you do differently next time?
It's a journey
It is a journey.
of continuous learning.
Continuous learning and growth.
And as you gain that experience and that confidence,
You'll find these communication skills become second nature.
yeah,
You'll be able to navigate complex situations with more ease.
and build those meaningful therapeutic relationships.
And really make a difference in your patients' lives.
So as we wrap up this deep dive,
Yes.
we want to leave you with a thought.
Yes. How can you, as future nurses, ensure that your patients feel empowered
No,
and actively involved in their own care, even when you're discussing those tough topics,
those sensitive topics.
those sensitive topics? This is something we really want you to think about as you embark on your nursing journey.
That's a great question.
It is.
Thank you for joining us for this deep dive
Yes.
into the art and science
Of patient interviewing.
of patient interviewing. Remember, you're embarking on an incredible journey.
You are.
And these skills that you're developing right now will not only shape your careers,
Yes.
but the lives of the countless patients you're going to care for.
Keep learning, keep practicing, and never underestimate the power of human connection
Absolutely.
and healing.
We'll see you in our next deep dive.